A very good evening, everyone. Welcome back to my channel, Basic Nursing Study Point.
Good evening, everyone. Welcome.
So here again, I am with you all with the very important topic, musculoskeletal system. So today we are going to discuss some important questions about musculoskeletal system, but not all the questions will be included. So we have divided this topic in two parts, part A and part B. So some of the questions we will discuss in part A and rest of the questions we'll discuss in the part B. So I request all the students to join very fast so that we can start. Please join fast. This topic is going to be very interesting, so I hope you all will join and share the link with your friends also so that they can also join. So let's start with the first question. So question number 1 is, in electromyogram, that is EMG, what we do? First option is insert needle into fourth or fifth intercostal space. Second is insertion of certain needles into certain muscles. Third is placement of electrodes over the chest. And fourth option is placement of catheter into the ventricles of brain. I request all the students, please participate in this and answer. Please reply on the comment box. All of the students who are watching this video, this live, please reply. Upma Gupta has answered B option, insertion of certain needles into the certain muscles. Kiran Chauhan B, Kanika B. गुड बच्चे, और भी रिप्लाई करेंगे. वर्षा ठाकुर बी आंसर. कृतिका राष्ट्रा बी. Very good बच्चे who have replied the B answer. This is very much correct. So what is EMG बच्चे? EMG is a process, that is electromyogram, to assess the functions of the muscles. Okay, so what we do, Meenakshi Thakur B, Akriti Sharma B, yes, B is the right answer. So what we do in this, we in the EMG, the healthcare provider or the doctor, he will insert the needles we also called electrodes into the muscles. Okay, so these electrodes that will be connected with the oscilloscope. The oscilloscope would be a display monitor. Okay, and it can be attached with the one audiometer so that we can also hear the contractions. Okay, so at the rest there would be no activity will be recorded on the screen, because at rest muscle contractions will not be there. But after inserting the needles, the doctor will ask the patient that to lift or bend the muscles, and then he will monitor the functioning of muscles, ki how they are reacting on the nerve stimulus. Okay, so I think this would be clear to you. In EMG we insert certain needles into the certain muscles. So B answer is correct. Now let's move to the second question. Carpal tunnel syndrome is caused by the compression of the median nerve, the radial nerve, the ulnar nerve, or the femoral nerve. Upma Thakur has answered A. Kritika Rashta A. Kanika A. Diksha Barwal A. Barsha A. Kiran Chauhan A. So all have answered A. Yes, this is very much correct. The median nerve, when this median nerve is at the palm side of the your wrist, and when it is compressed, maybe you are working on the computers, regular working on the, or the regular pressure on that nerve can cause the carpal tunnel syndrome. Tingling could be there. Okay, numbness can be there. So The first option is correct. It was very direct question. Now let's move the further slide. Haberden nodes are seen in, first option is rheumatoid arthritis, or second is osteoarthritis, then C option is spondylosis and D is tendinitis. सभी बच्चे आंसर करेंगे. किरण चौहान बी, कनिका बी, दीक्षा बरवाल बी, कृतिका राष्ट्रा ए, आकृति शर्मा बी. ओके, rest of the students I request you to answer Haberden nodes. Barsha Thakur A B, Upma Gupta A and B may confused. Okay, Barsha Thakur B and Lovely Rana B. The B answer is correct, bache. The osteoarthritis is the correct answer. Firstly, you should know what is Haberden nodes. And Haberden nodes are the nodes which are near to the nodes which are present here near to the nail bud. So these nodes are Haberden nodes, and these are the characteristic signs of osteoarthritis. Although rheumatoid arthritis and osteoarthritis, they are very much similar to each other, but in rheumatoid arthritis it is the autoimmune disease. The main cause is autoimmune. But if you want to see the main difference between rheumatoid arthritis and osteoarthritis, then these symptoms can differentiate between them. Haberden nodes can be seen in osteoarthritis. Let's move further. Fourth question is, clinical manifestation of ankylosing spondylitis include fever and headache, fatigue and night sweats, low back pain, or D option is urinary incontinence. Please answer. D, urinary incontinence. Upma Gupta has answered D. Akriti Sharma C. Munesh Sangman D. Kiran Chauhan C. All the students will answer. What is the main characteristic manifestation of ankylosing spondylitis? Barsha Thakur D. Okay. So, bacha, what is ankylosing spondylitis? In this, the vertebrae of spine get fused, especially the low back pain will be there. So, it will be chronic lower back pain. So, the main answer, the right answer would be low back pain. Okay. Later on, other things can be happen, but main clinical manifestation of ankylosing spondylitis is chronic low back pain. These questions are very much direct. Nothing is required to explain more. So that's why I am moving further. Question number 5. Abnormal hardening of bone and an elevation in bone density is known as, first is osteoporosis, second is osteopetrosis, C option is osteomalacia, and D option is arthritis. Kanika has answered D. Kiran Chauhan D. Akriti Sharma D. Lovely Rana D. Diksha Barwal D. They are asking about the abnormal hardening of bone. Please read the question properly. Diksha Barwal D. Everyone has answered D, arthritis. But abnormal hardening of bone and elevation of bone density is known as osteopetrosis. Osteoporosis, you all must know, that is the weakness of the bone when your bone become very porous. Okay. Osteopetrosis is when there would be the density of the bone will be more and it will become hard and more prone to the fracture. That term is known as osteopetrosis. Osteomalacia, you know, okay, when bone metabolism is disturbed. Arthritis is inflammation of the joints, basically. So the right answer is osteopetrosis. I hope you all are understanding. Let's move further. We are done with 5 questions. Now the sixth question is NCLEX based. Okay, I have included 2 questions, NCLEX based questions in this live session. So question number 6 is NCLEX based. Uh, Listen it to properly. The school nurse is attending a student athlete who reports muscle pain. It is not pain, pain after practice session. What should the nurse identify as a cause of pain when providing instructions to the student? सभी बच्चे रिप्लाई करेंगे. Kanika has answered A, lactic acid. Upma Gupta A, Kiran Chauhan A, and any one of you can explain this answer? Yes, A is correct, but any one of you can explain why answer A is correct? Any one of you who has answered A, like Kanika, Upma, Kiran, Barsha, they all have answered A. Could you please elaborate your answer? Okay, so let me explain you. So bache, what happens when muscle contracts or when a athlete practice? YouTube connection A. Yes, A is a correct answer. So what happens, bache, when there would be, athlete is doing practice or any contraction of the muscles, so there would be requirement of more energy. Lactic acid accumulation cause pain in muscles, right, Kanika? So why this lactic acid accumulate? When the energy is required for the athlete, they oxygen is required to convert glucose into energy, right? So anaerobic conditions will be there. In the anaerobic condition, lactic acid will be produced and it will be accumulated in the muscles and it will cause pain, right, Kritika Rajta? This is correct. So lactic acid is the main cause of pain while doing the practice session by that athlete. If I talk about butyric acid, so butyric acid is a fatty acid which is generally present in perspiration or feces because it is formed in intestine, right? Third is acetoacetic acid. It is a ketone part of the any fatty acid. HCl, you must know, hydrochloric acid. It is formed in gastric region, right? Now let's move further. Question number 7. A client who had an ORIF of a fractured ankle is being discharged. Which behavior indicates more need of instruction? Answer options है A. Advancing both crutches with weaker leg. B. Leaning axilla on the crutches to support the body's weight. C. Transferring the crutches into one hand when sitting in a chair. D. Moving the crutches before the unaffected leg when descending stairs. So firstly, you will tell me what is ORIF, O-R-I-F. Can you tell me the full form of ORIF? Upma Gupta has answered B. Okay. All the students will answer and they will also tell me what is ORIF, O-R-I-F. What is the full form of ORIF? Open reduction and internal fixation. Upma Gupta, right? It would be internal. Okay, so बाकी बच्चे भी आंसर करेंगे. What would be the correct option? A, B, C or D? A client who had undergone for open reduction internal fixation fracture of ankle and he was getting discharged. So, which his behavior will indicate that he needs more instruction? Akriti Sharma B, Kiran Chauhan B. Good. And tell me the rationale also. Why it is B? When patient, Upma Gupta has answered, when patient support with axilla, then axillary nerve pass होती है. Okay. One plexus is there. You are right that one brachial plexus would be there and it will be injured and that will cause crutch palsy. What we call this situation? Crutch palsy. Okay. So B answer is correct. Go. Let's move further. Lateral curvature of spine is called as, direct question, you must know this, lordosis, kyphosis, scoliosis or osteomalacia. Upma Gupta has answered A. Akriti Sharma A. Kiran Chauhan A. Barsha Thakur C. Answer fast. Rest all the students, please answer. Barsha and Karnika has answered C. So, bache, you must know C is the correct answer, scoliosis. Here they have asked lateral curvature. ओके हमेशा याद रखना लॉर्डोसिस जब आपका जो है काइफोसिस में क्या होता है एक हम्प बन जाता है ठीक है दैट इज काइफोसिस लेकिन लॉर्डोसिस में हम्प नहीं इनवर्ट जो है स्पाइन का कर्वेचर हो जाएगा ठीक है लॉर्ड से याद रखना जैसे बिल्कुल जो है आपकी जो चेस्ट जो है आगे होती है ठीक है लॉर्ड से याद रखना दैट इज लॉर्डोसिस काइफोसिस जब हम्प बनता है स्कॉलियोसिस लेटरल कर्वेचर ऑस्टियोमलेशिया इज डिफरेंट थिंग राइट Now question number 9 is longest muscle in the body is sartorius muscle, masseter muscle, stapedius muscle or deltoid muscle. Karnika has answered A, Akriti A, Upma Gupta A, Barsha Thakur A. Good. I think you all have studied the musculoskeletal system very well. So you know the answer sartorius muscle is the longest muscle. So what's about masseter muscle? It is the strongest muscle for the mastication. It is used for mastication. And stapedius muscle is the shortest muscle. Right? So now we have reached to the last question. After menopause, women are more prone to have osteoporosis because decrease in estrogen level, increase in estrogen level, C is decrease in LH level or D is decrease in FSH level. Barsha Thakur has answered A, Kanika has answered A, Upma has answered A, Kiran Chauhan A. So why it happens? I think you all must know about that when estrogen level is decreased, women becomes more prone to have osteoporosis. But why? What it does? What is the role of estrogen? Please write your rationale. What is the role of estrogen? Why it happens that when it get decreased, women becomes more prone to osteoporosis? What this hormone does? आंसर करेंगे बच्चे? ये तो सभी को पता है कि ए आंसर है, एस्ट्रोजन लेवल डिक्रीज हो गया, लेकिन क्या काम करता है एस्ट्रोजन, क्यों? बिकॉज एस्ट्रोजन हार्मोन इज अ, हाउ डज इट वर्क? वैसो प्रोटेक्टिव है ये, ठीक है, वेसल्स की प्रोटेक्शन करता है, वहाँ पर इन्फ्लामेशन होने नहीं देता है, इसलिए जब इसका जो है लेवल कम हो जाता है आफ्टर मीनोपॉज, तो विमेन जो है मोर प्रोन हो जाती हैं ऑस्टियोपोरोसिस के लिए, ठीक है. So this was our last question. We generally discuss only 10 questions, but in the musculoskeletal system, 10 questions are not enough. So I will bring some more questions about musculoskeletal system in my next live. I hope you must have understand a lot of things, lot of concepts, because what I tried, I just want to keep all those. I want to keep different questions so that different topics can also be discussed over here. Like we learnt about the role of estrogen, right? We learnt about the lactic acid. We learnt about how axilla nerves passing through to the axilla are getting hurt, and crutch palsy could be there, right? So I just try to keep the important questions, and I request all of you to open your books after getting after this session. Open your books, just look at the musculoskeletal system, right? And you will get more knowledge about that, and your topic will be more strong, and you will be ready for the exam. Okay, so with this I think I should stop my live. Thank you and good night everyone.